Hello lovelies, welcome back to the channel. For those that are joining us for the first time, in this channel we talk about migration, nursing, traveling and everything else. So today we are going to talk about nursing and specifically types of medications that are administered in the nursing care homes, or not even nursing care homes only, the care homes in the United Kingdom. So if you are interested on this type of information, please consider subscribing. And hello my lovelies, welcome back to the channel. My name is Mboi. I'm a nurse. I work in a care home in Wales. So we are going to talk about drugs, the common medications that are administered in the care homes, or those that are prescribed for people who are living in a care home. All right, so all that you need to know is that care home, even though it's a home, it's actually a health facility. So the nurses have to maintain NMC standards even in the care home. So when we are dealing with medications, we always have a BNF in a form of application on a tablet or a computer desktop, or as a book, like it's as thick as this. All medications that you can think of are included in that BNF. So don't worry if you don't know any track, you just go through that BNF. It's arranged in alphabetical order and it has indications, side effects, contraindications, everything that you may need to know on a certain track. So don't go on and try to learn medications like from the scratch. You don't need that. You won't retain that kind of information anyway. There's just a lot of medications on this world to try and encompass them in your head. So BNF is there to guide you. And also remember that there are guidelines that we need to follow, NMC guidelines. There is also a nice, what is it called? I can't remember it in full, but it's nice. It's NICE protocol for medication administration. And so when we deal with drugs, the same way we deal with them in hospital, it's the same way we deal with medications in a care home. All medications, including injections, topical application medications, tablets, suppository, pessaries, they are there. Controlled drugs in the form of tablets, capsules, syrup, injections, patches. So the controlled drugs, they have a cabinet in a drug room, locked. There is a cabinet specially made for controlled drugs. You put them in there, lock that cabinet, then lock the room where the medications are kept in. There is also a fridge for medications that need to be kept under cold conditions, like eye drops, injections for insulins, something like that. So nurses also keep record of temperature on that fridge, so that when it's off, you know that medications in that fridge are no longer safe for administration. Okay, those are the things that you need to take into consideration before you can start any medication round. So you need to have your BNF in place, check the temperature, make sure the control tracks have been checked and balanced and they are locked. If you need to take any control medication, you need to have at least 2 people. It's either you and a nurse, or it's you, the nurse on duty, and the nurse manager to take the medications, or anyone who has or anyone else who has gone under the English, come back. Right. Anyone who has done the training in medication administration, then you can countersign each other for controlled drugs. But you have to make sure that they have been signed off for competency in medication administration, and so that you are safe, you need to make sure that everything is safely done. Right. Now let's get into the classes of drugs that are common in the care homes, and mention examples here and there. So the very first class of medication that we have in a care home is pain relievers or painkillers, analgesics. So they come in different forms. They can be liquids, tablets, capsules, patches, topical applications. So these medications can also be the over-the-counter ones like paracetamol. But if you were to administer any over-the-counter pain relief medication, it also needs to be reflected on the patient's medication administration record, because if anything happens to that individual, we need to know what medication they had, what food they ate, what did they drink, and so on and so forth. And you document that. You also have to have a signed off care home protocol for over-the-counter medications or homely remedies. They need to be checked by the GP and be signed off before you can use them. Even though they are over the counter, the ingredients or the properties that made that medication may be fatal to another person. So we need to know who took what when. Even if it's not a controlled one, even if it's not prescribed, we need to know, so that we can manage any shortfalls or any illnesses that may arise. So the common ones that are used in the care homes is paracetamol. The care homes hold individuals who are elderly and suffer from maybe osteoarthritis pain. So you might find ibuprofen topical gel. You might also have paracetamol in the form of suspension and tablet, or you can also have opioids like stronger painkillers. So it could be morphine, just to keep the residents comfortable. And these pain relievers always need to be signed after administration. So painkillers sometimes can be PRN, which is when necessary. You need to know if this particular individual on the previous shift got a pain relief medication at what time, so that you will know the next dose is when. You see, that's the class number one. The other class that is very common is laxatives. Okay, laxatives can come in form of powder, tablets, capsules, suppositories, or even oral solutions. So we all know that when people grow older, the metabolism changes, like it decreases, advanced old age, also the type of nutrition, suboptimal nutrition. They only eat one type of food, and if it's only one type, we know sometimes it might cause fecal impaction. So you might need to always have a regular laxative prescribed. Even reduced mobility causes constipation. So there are lots and lots of laxatives prescribed by the GPs. It can come as the examples that we have here in UK. It's a powdery It's a powder form. I don't know how to explain this, but it's called a Laxative. It's a powder form. You just have to dissolve it in water or squash, however the resident prefers it, but it should be equivalent. There are instructions that comes with the prescription. There are tablets like Senna tablets, Docusade, and maybe suppositories here and there. Sometimes they are also prescribed enemas, like a small slimy liquid, I can't remember its name, that is always administered as a last resort in the care home. Right, moving on to another class of medications or that are common in the care home, we also have cardiovascular medications. This is a vast, big class of medication. Like, there are a lot of subclasses under cardiovascular medications. There are hypertension medications, blood thinners, statins. There are many cardiovascular medications. So in hypertension or coronary heart diseases, you may have furosemide, you might have bisoprolol, digoxin. So there are other types of cardiovascular medications which are statins. So the common one is simvastatin or atorvastatin. So with blood thinners, there are antiplatelets and anticoagulants. So you might find that your residents have warfarin or what is this one? Apixaban. So with cardiovascular medications, you all know that we need to monitor the vital signs like nobody's business. Like if you were to give a digoxin, you need to know the pulse rate before you administer it. If you need to give people hypertension medications, you need to know the blood pressure. We also have statins. We need to know the level of cholesterol, platelet count for antiplatelets, and so on and so forth. So with cardiovascular medications, you really need to know what type of assessment is needed for a specific type of cardiovascular medication you are administering, because if you give someone with let's take for an example, this person has had arrhythmias and the pulse rate is about 50 beats per minute, and you administer digoxin. What are you expecting? So always be vigilant. This is why you will always need to have a BNF next to you. It will explain everything that you need to do, what you need to do before administering, what you need to do after you have administered, what side effects to watch for, what are the adverse effects, when to call emergency services, or just when to call the local GPs. So that's another that's all I can say for about the cardiovascular medications. There are also other there is another class of medication called adjuvants. These are used to control pain, but they also have other indications. So adjuvants used in combination with painkillers increase efficacy of painkillers. So these adjuvants could come as antidepressants, corticosteroids, or anticonvulsants like antidepressant amitriptyline can be given to help in management of neurological pain. So you need to know why drugs are prescribed, because you might know that this is an anxiolytic, it's an anxiolytic medication, but why is it given with why is this person getting an anxiolytic whereas this person does not have any condition that is suggestive of anxiety, So adjuvants are medications that are given to control pain, but they are not indicated for pain per se. What I know is adjuvants sometimes are given to people to control pain. So in the care homes, you will find cholinesterase inhibitors, and there are many tablets under that class, but the commonest one that is used in the care homes is donepezil. You'll find that anyone with Alzheimer's disease, they are prescribed donepezil. Actually, it's given for people who have early dementia to moderate dementia. The other class of dementia medication is glutamate regulators. So the glutamate regulators, the commonest example is memantine. It can be given to people with moderate to severe dementia, or like the Alzheimer's dementia to be specific. Sometimes even people who have vascular dementia are prescribed memantine. It's given to people with moderate to severe dementia. Now, like I said, in the care homes, you might have people who are diagnosed with Parkinson's disease. So there are anti-Parkinson's disease medications that are prescribed. You find that they come with the prescription already, or they might develop the Parkinson while they already in the care home. Another common class of medication that you can find in the care home is antidiabetics. It goes both ways, either the type 1 or type 2. You will find both in the care homes. So if this person is still able to take tablets, it could be metformin. It's still the common one. And with type 1 diabetes, it's insulin injections. So yeah, the other type of medications that you will find in the care home are medications for people who have challenging behavior. So challenging behavior can come as aggression, agitation, or crying spells, distress, or even physical, like if this person is physical with the carers, like fighting when you're trying to help them, then they can be prescribed some medications. And the commonest one that is used in the care homes is lorazepam. So people with challenging behavior, they are prescribed some medications to help them calm down, coupled with encouragement and activities of daily living. Include them in a lot of activities. Don't just administer medications. So those medications come as use when needed, which is PRN. You can try all other methods that are not medicated, and if they are failing, that's when you can go on with medication one. So the common one is lorazepam and diazepam. Okay, last but not least, there is what is called end-of-life care in the United Kingdom. It's part of nursing care in the care homes. When someone has been diagnosed with terminal illness and they are approaching the end of life, there is what is called end-of-life care plan or advanced care plan that will be put in place, and it will be accompanied by medications like morphine, cyclazine, hyoscine, just to keep this person pain-free and comfortable as much as you can. So sometimes they may need to use them, or sometimes there may be no need to use them. So they are prescribed as a pack of end-of-life medications. You as a nurse, you will assess the need to use those medications. They will be prescribed already and be kept in a care home under lock and key for you to use them when the need arises. So pain, nobody like on this earth would like to experience pain, let alone when you are approaching end of life. So morphine injections, midazolam injections, cyclazine, haloperidol, there are many. So those are the ones that are prescribed, and you keep them under lock and key, and you can use them when there is a need for your resident to be comfortable. And with end of life, make sure that all the time you involved the family members, you communicate every change, and if ever they may need to come and see him before the end, you communicate every step of the way. I know family members, sometimes they will communicate what they would like you as the nurse to tell them. They sometimes prefer not to see their loved ones die, and sometimes they prefer to see their loved ones die. So it's your duty to know the wishes of the family members of your resident. You also have to take into consideration the wishes of your resident. If your resident have had wishes documented, they will be communicated. If this person does not want her children to see her die, and it was well communicated ahead of time when she still has capacity or he still had capacity, then you have to honor their requests. So those medications are meant, end-of-life medications are meant to keep your residents comfortable, pain-free, breathing not noisy, no agitation, relaxed, so that the end of life period is not painful. So you as a nurse, you will administer them in their care home. And I think these are the commonest medications that are used in a care home, and they are not limited to this one. There are many other medications that are in the care home, including nutritional supplements like Ensure supplements. We also have mineral supplements like iron supplements to prevent anemia or to treat the existing anemia. There are many, so these are the common ones that you will always come across when you work in a care home. Always. So if we go through them together, it will be pain relievers, laxative, cardiovascular medications, adjuvant medications, dementia meds, medications for challenging behavior, Parkinson's disease medications, diabetes mellitus medications, sometimes even asthma medications like COPD medications, salbutamol, inhalers. So there are many. Just know that when you come and work in a care home, you will come across painkillers, laxative, cardiovascular medications, asthmatic medications, end-of-life pack, dementia meds, Parkinson's disease medications, diabetic medications, and so on and so forth. So UK is very advanced. There were so many things that I didn't even know exist. So just come prepared to learn. Thank you very much for watching this video thus far. I will see you in my next one. Bye.